It's also known as allergic rhinitis or hay fever. This can either be year-round or seasonal. So if it's year-round, it's called perennial allergic rhinitis. If it's seasonal, then it's called seasonal allergic rhinitis. Um, there are many things can cause this. It can be dust, pollen, mold, danders from animals, their hair, trees, weeds, grasses, a number of things. Typically, it affects the conjunctiva of your eyes and the mucosa of your upper respiratory tract. So your clients will have sneezing, nasal congestion, runny nose, itchy, watery eyes. Sometimes they have an itchy nose and throat. Have you all ever heard anyone who scratches their throat? No?
Okay. Yes, ma'am.
Yes. It's kind of irritating, isn't it? Well, at least for me. I can't stand to hear it. And you know that we always do a good history and physical on these clients. Many people who have asthma, so if you know someone that has asthma, they will also suffer from this as well. So what we do is we typically tell people to avoid whatever is causing an exacerbation of these allergies. We tell them, because when there's a release of histamine, we tell them to take antihistamine, your decongestions, your corticosteroids, and immunotherapy. Immunotherapy is another name for allergy shots, and we'll talk about that in a minute. You know, your antihistamines like your Claritin, Allegra. Does that sound familiar to you guys?
Yes, ma'am.
Your corticosteroids. We try to make steroids like the last thing. We don't want that to be our immediate go-to medication because of the number of side effects, the allergy shots. We try to build up sensitization to the allergen that they may be experiencing. The way it's diagnosed, again, through history and physical. Sometimes they may do a nasal smear, or the patient may have IgE levels drawn. But remember, if you have allergies, you are going to have an IgE level. We tell them Benadryl. Benadryl is sedating. So ideally, we want the clients to take Benadryl at night. You know that you tell clients not to operate heavy machinery with Benadryl. What's another one? I told you Zyrtec, Allegra, Claritin. Anything else? Any other ones that you all know of? Let's see.
Singulair. What about Singulair?
Singulair, that is another one. Thank you. I think that's it. Make sure you tell them about the Benadryl, the sedating effects of it, not operating heavy machinery, no driving. I think that's it, Jeanette. Immunotherapy, I told you, called allergy shots. This is where patients come in over a period of time and they receive the allergen that they're suspected of being having an allergy to. So they receive that allergen over a period of time to reduce the reactions or to reduce the symptoms that they experience when they encounter this. Whenever your clients come in for immunotherapy, you always want to keep them at least 30 minutes in the office to make sure that they don't have an anaphylactic reaction. If you look at page 201 in your textbook, under nursing management immunotherapy, Always make sure that you have your emergency card or your crash card available. Airway, breathing, circulation is very critical in anaphylaxis. So you always want to make sure that if they're experiencing an anaphylactic reaction, that they have a patent airway. Always know that you need a large IV. But it tells you after giving an allergy injection or allergy shot that you keep your patients anywhere from 20 to 30 minutes.
Just take it. Stop talking back to me. I said.
And that you can see that, find that on page 201. Are there any questions about this thus far?
No.
Okay. Then you have atopic dermatitis. This is a type 1 hypersensitivity reaction. It is a skin disorder, also known as eczema. With atopic dermatitis, these people are believed to have a triad of symptoms. And I kind of talked about this with the skin lecture. So when we say triad, they have 3 disorders going on. And it's typically asthma, allergies, and eczema. People with skin disorder, you kind of take care of most of them the same. Cotton clothing or cotton fabric, mild detergent, humidify dry heat, maintain a cool environment, use your antihistamines, moisturizers, topical steroids are important. The hallmark sign for atopic dermatitis is itching. So their skin is very dry, itchy. They can have some redness and swelling going on. But again, they have very dry skin and it's very itchy. With atopic dermatitis, they have periods of remission and exacerbation. We want to prevent secondary infections. We have the client trim their nails. So when they're skin itching, you know the skin is the first line of defense, right? We don't want them breaking their skin and introducing bacteria into their system. And so part of decreasing that itching and scratching is having them wear cotton clothing, a cotton fabric, using mild detergents, free of perfumes and dyes, humidify dry heat, being in a cool environment. What else they shouldn't do? What else can increase your itching? This is from your skin lecture. Drinking what?
Warm stuff, like hot teas and stuff.
Yep, absolutely. Warm teas, hot things. We don't want them taking hot showers because hot showers further increase your itching. Remember, they have a release of histamine. It is the histamine that causes the itching. We want them to blot dry.
Couldn't they use cold packs?
Say that again, Skylar.
Couldn't they use cold packs to help with the itching?
Yes, they definitely can. They can use cold packs. And they may have to use some topical steroids. And if it's too bad, then they'll be on something oral, an oral steroid. Okay, so contact dermatitis, type 4 delayed hypersensitivity reaction. You have poison ivy, your soaps, your cosmetics, dyes, and detergent. Your symptoms include red and edematous skin. They complain of pruritus And we all know how to take care of pruritus, correct?
Yes, ma'am.
Okay. I was about to say that you all should know how to take care of pruritus. Any questions? And how many of you all use your mascara a long time? Or do you change it? With some of you may use so much mascara, you having to buy new mascara, what, every 30 days? For like a person, me, I may not change my mascara for a year. I start to change it once I realize that I'm having a reaction, like my eyes start itching, I have a little swelling around my eyelids. So that lets me know that, okay, my mascara is old, it's time to discard it now. Okay, type 4 hypersensitivity. This can occur anywhere from 24 to 72 hours later. Again, example, your PPD, your TB skin test. Cosmetics can cause this. Some patients have a reaction to the tape. Make sure you're monitoring your patients for that when you're in the hospitals. And poison ivy as an example of a type 4 reaction. Remember I said latex allergy. This can be a type 1 or type 4 reaction. The risk factors for latex allergy includes your healthcare workers, such as yourselves, people who have frequent allergies. Not frequent allergies, frequent surgeries. People who work where they make latex. Those clients with spinal bifida. If you have allergies to certain foods. Symptoms can either be mild to severe. They can have anywhere from a skin rash. If they're having an anaphylactic reaction to it, they can have a drop in their blood pressure, hypotension. They can have difficulty breathing. If you don't intervene quickly, it can end in death. So when we say certain food allergies, so those people that have allergies to kiwi, papaya, avocados, and apricots may also have a reaction to latex. If you look on page 201 of your textbook, it talks about latex food syndrome. And it lists the foods there. If you have your textbook, can you turn to page 201, please?
Yes, ma'am. We see it.
You see it? All right, so put a little highlight there. You do need to know that. Make sure you know people with spina bifida, neural tube defects, those people who have a lot of surgeries, healthcare workers such as yourselves. Typically, when people have latex allergies in the hospital, we make sure that it is on their chart. We make sure that it's in their room, like we'll put a sign above their headboard. Sometimes there's a sign outside the door, latex allergy, and they have what is called a latex-free cart. For the most part, the hospitals use a lot of latex-free supplies now because of the rise in latex allergy, even among healthcare workers. So on the latex-free cart, everything is latex-free. Catheters, any supplies that you use for that client needs to be latex-free. Anaphylaxis. This is, again, the most severe form of a reaction that a person can have. This occurs rapidly and it can be life-threatening, involving a person's whole body. It can lead to difficulty breathing and shock, ultimately ending up in death. There are a number of things that can cause anaphylaxis: foods, tree nuts, shellfish, milk, eggs, soy, and wheat. We definitely teach our clients to read food labels. People who have a history of anaphylaxis, also they carry an EpiPen. You need to know that Epi is 1 milligram per mil given IM in the vastus lateralis. We treat anaphylaxis with antihistamines, corticosteroids, IV fluids, volume expanders, and vasopressors, things that keep the blood pressure up. Because you want to maintain fluid to the vital organs, so this is important. Some other causes can be certain medications. Let's see. You tell, they may have to, where you want to teach your clients to wear a Med Alert bracelet. If they have anaphylaxis, be sure you teach the family members also how to administer the epinephrine. Some medications like penicillin and sulfa, iodine. So whenever your patients are having CT scans with contrast, you always want to ask if they're allergic to iodine. Same thing in shellfish, iodine. Other medications, aspirins, NSAIDs, sometimes bee stings. Do you all know of anyone who has anaphylaxis?
My grandmother had it. She would swell up really bad if she got stung by bees.
Oh, really? Yes. So that's frightening. So having that EpiPen and teaching your clients how to use it is very critical. They can also, like your antihistamines, Benadryl, a cough syrup. I had allergies for a while, and one time I had a real severe, and it acts up every now and then, but I'm a non-compliant patient. I have to be honest with you. Like, I eat shellfish, allergic. I eat chocolate, allergic. Pineapples. Sometimes I eat pineapples and my tongue swell. But, you know, I have my rescue drugs, my steroids, my antihistamines, I have cough syrup, but I'm not your patient that listens. But you want to tell your patients, stay away from these things, avoid these things, make sure others know these are listed as your allergies on your chart. The Med Alert bracelet is very important as well. Immunotherapy, I kind of talked about this a little bit earlier, also known as allergy shots, is given sub-Q. As the nurse, if you want to instruct your clients that they should keep their appointments, if they should miss their appointments, because over time you're gradually increasing the dose or introducing them to the allergen that they are allergic to. So if they miss a week or two, then you have to ask the healthcare provider, how much allergen should I give them today? Because remember, you're gradually building them up so that they can become sensitized to this. Always administer away from a joint. Aspirate before injecting, and I know that this is a sub-Q injection, to avoid a blood vessel. Can you imagine if you give the allergen in a blood vessel? We know that's systemic, correct?
Yes, ma'am.
Nurses, it's systemic. If you put it in the blood, it is systemic. Then they're more likely to have a severe reaction. You want to observe your patient 20 to 30 minutes for a severe reaction. Again, make sure you have the emergency card available. ABCs, airway, breathing, circulation is critical. HIV, human immunodeficiency virus. So what do you all know about HIV?
Affects the immune system.
Say that, Markel, say it again.
Well, I didn't say that, but they were saying it's an immunodeficiency virus.
Okay. And what? Okay, I'm sorry. I thought you had said something. Okay, and immunodeficiency virus, and what does that mean? Okay, class. Now
It's an acquired. It suppresses your immune system.
It does. It suppresses your immune system. So how do we contract HIV? Maybe I should ask that.
Oh, sexually.
Bodily fluids.
Yeah.
Bodily fluids. What bodily? Can you get it just from kissing a person?
No.
So what do you mean when you say bodily fluids?
Like if you're
Blood and plasma.
Okay. Good job. So a few fast facts about HIV. There are approximately 1.1 million people living in the U.S. and today it may be actually more people that are living with HIV today. Once upon a time, HIV used to be a death sentence, but now it's actually considered a chronic illness. And about 15% of people are walking around HIV positive and unaware that they are infected. So we there's a lot of education to be done, but we have to find a way to dispel the myths and the stigma that is associated with HIV and AIDS. So there were over 17,000 people in the U.S. that had a diagnosis of AIDS. So AIDS is the end stage of this disease of HIV. Nearly almost half of the people that had an AIDS diagnosis lived in the South. So where are you? Where do we live?
South.
In the South, right. So it is an issue here in the South. So HIV is a retrovirus, meaning it replicates backwards. It has to insert itself into your DNA and start to replicate backwards. So it goes from RNA to DNA. So the genetic information of HIV is located in the RNA, but in order for it to attack your body, it actually has to get, or to replicate, it has to actually insert itself into the DNA. And so like all viruses, HIV cannot replicate unless it is inside a living cell. So the viral DNA enters the T lymphocytes of the T cell, and that's how it begins to make copies of itself. If you have too many CD4 or T cells that are destroyed, then your immune system becomes so weak that it can't protect the body anymore. And please note that the older adults are the underdiagnosed population. The normal CD4 count T cells is 500 to 1600. We're going to go, that value is what the CDC says. Centers for Disease Control. HIV causes immunosuppression. Therefore, people are open or more susceptible to infections and getting sick often. But keep in mind, I said it is a chronic disease now. All right, the way HIV is transmitted, it is through body fluids, blood, semen, vaginal secretions, and breast milk. So you want to tell pregnant moms who are HIV positive that they should not breastfeed their babies. And that is why they have pregnant moms do an HIV test. If you have a mom who shows up to the birthing center or to the emergency room delivering as they're coming in, we always do a rapid screen on them to see if they're HIV positive so that they can have a cesarean, delivered by cesarean as opposed to a vaginal delivery, because it does pose risk to the baby. Remember, HIV is not spread through casual contact. So if someone who is HIV positive holds your hand or give you a peck on the cheek, a little kiss on the cheek, you will not become HIV positive. Even if you sustain a little needle stick in the hospital after you've given an injection to an HIV positive person, doesn't mean that you are going to become positive for HIV. It is through subsequent exposure. It has to be a large amount of blood. All right, sexual transmission. Sexual activity involves contact with semen, vaginal secretions, and or blood, all of which has the lymphocytes that may contain HIV. The greatest risk is the partner who receives semen, prolonged contact with infected fluids. Women are at higher risk, and because they sustain trauma, trauma increases the likelihood of transmission as well.
Dr. Coulter.
Yes, ma'am.
For some reason, I can't see the slides anymore.
Is that
black?
Can you all see them?
Yes. Yes, ma'am. Yes.
I don't know, Jessica.
Okay, maybe if I can log out and maybe get back on.
Yes, if log out and you can come back in.
Okay, let me try that. Thank you.
Okay. So know that sexual activities that cause trauma to local tissues can increase a person's risk of transmission. Genital lesions from other sexually transmitted infections, such as herpes and syphilis, can significantly increase the likelihood of transmission. So if a person has a history of these diseases, herpes or syphilis, then they're at an increased risk if they come in contact with the HIV virus of becoming HIV positive. Sharing of drug paraphernalia is important. So people who share needles, syringes, straws, and other equipment that may be contaminated with HIV or other blood-borne organisms can increase their risk of becoming HIV positive. When you become nurses, there are some places that have where addicts can get needles, clean needles. this may be something that you advocate for. I mean, wouldn't we rather them have a clean needle than a dirty needle? It's easy to tell a person to kick an addiction, right? Nurses, where are you?
No, ma'am.
So, you know, just telling a person, oh, they should, you know, stop using drugs or just kick that habit or whatever, that's not always as easy. So we may need to provide clean needles for them. Puncture wounds are the most common means of HIV related transmission. So if they have that broken skin or they reusing or using dirty needles, you know, we have to educate our clients, you guys. That is very, very important. Perinatal transmission, this can occur during pregnancy, delivery, or breastfeeding. So we should be using standard precaution on all of our clients. So you need to treat everybody as though they have HIV, or treat everybody as though you don't know whether or not they have HIV. Make sure you understand the difference between airborne, contact, and droplet precautions. If working in the hospital, if you sustain a needle stick, you want to wash your hands first with soap and water. Report it to your supervisor, whether it's your clinical faculty, when you're a student, or if you're out as a nurse. Make sure you report it to your charge nurse, your manager. They will test you for HIV and hepatitis, test your client for HIV, hepatitis. Remember, it takes a large amount of repeated exposure. If your immune system is working optimally, it will work to fight off any diseases. So if you're healthy, you will more than likely not convert to HIV positive if your client is HIV positive. So it's like, it's a 3 to 4% chance out of 1,000 that people become HIV positive. So it's not a high chance, is what I'm saying. If you get a splash of blood in your eyes, make sure you wash your eyes out with water and then follow the protocol. Sometimes what they do, they will put people on prophylactic antiretroviral medications, and then you will have a test 3 months, again at 6 months, and 1 year. If you don't convert to HIV positive after 1 year, then you are good to go, you're negative, unless you're engaging in high-risk behaviors that put you at risk. Prevention, education again. We want to educate people about abstaining, not engaging in high-risk behaviors. Safe sex practices is very important. We want to tell the clients that using, what I want to say, you all, latex condoms is the best. All of these feel-good condoms, such as lambskin, are no good. Got it? Latex is the most safest. If they're allergic to latex, then you tell them to use the polyurethane or the plastic condom. You want to educate your clients to avoid sharing needles. You want to talk about reproduction, family planning if they're HIV positive, transmission, the use of contraception. If they're HIV positive, then they should be on some contraceptive. If you have 2 people and they both are HIV positive, you want to educate them that they may have different strands of HIV, so they still should be engaging in protected sex. This is just an image of oral condoms that you will need to educate your clients on. And I think it's in your book. It's called Dental Dams. And this is a barrier that you can use during oral sexual activity. Safe sex practices includes masturbation, or mutual masturbation, or other activities that does not that meets the no contact. Y'all have any questions?
No.
Have you all had a chance to take care of any HIV positive clients in clinical thus far?
No.
So no one has had a patient with HIV?
No, ma'am.
Okay.
Yes, ma'am.
No, but I remember reading something. It was like if the patient's white blood cells or something was like a certain amount, they don't have to say that they're HIV positive.
Well, you know, really, regardless to what their counts are, people don't have to disclose. However, we do want them to disclose, especially in the hospital. So they may come in, say, for diabetes, but they do have a history of HIV. If they're there for their diabetes, they don't have to tell you that they're HIV positive, because you're there treating the diabetes, right? We want them to disclose so that everybody can be taking precautions. But what I said, we should be using standard precautions on all patients, regardless if we know their status or not. But no one have to disclose their status unless, now, if you're out there engaging, it is illegal to know that you're HIV positive and have unprotected sex and not notify whoever it is that you're engaging in. That is a felony. People go to prison for that. I have taken care of clients who were newly diagnosed having HIV and they did not want to disclose either to their partner or to their spouse. And I could not say anything. And you see the interaction of this person with the other person, and you know as the nurse, okay, they've just been diagnosed as HIV positive. There are different stages of HIV. So the first one is the acute phase, acute infection. This is stage 1. This can occur within 2 to 4 weeks after someone becomes infected with HIV. These people may have flu-like symptoms that may last a few weeks. Their symptoms can include fever, swollen lymph nodes. They may have a sore throat, headache, overall not feeling well, nausea. They may have some muscle and joint pain, diarrhea. During this time, they have what is called a high viral load. So they have a high amount of virus in their system, and they're highly infectious. But now, if their immune system is working, remember, initially the immune system will work to kill this virus off, work to get rid of it. They may have a drop in their white blood cell count, the T or CD4 lymphocytes, the T cells. They may have a drop, but then because the immune system is working, their T cell counts come back to normal. And they may say, oh, I feel bad today, or I feel bad this week. they could really be HIV positive, and next week they feel better, but they are still continuing to engage in unprotected sex, not because that is their intention. It could be because they don't even know they're HIV positive. And this is how a lot of people, or how the disease is transmitted, because people really don't know that they are positive. They just may feel bad this week, but then next week they feel more like themselves. Then you have what is called asymptomatic infection, or stage 2. If this stage, if left untreated, then a patient can end up with a diagnosis of AIDS in about 10 years after the initial infection. But HIV has become more of a chronic illness when people